Hi everyone, this is Michelle from the snooZze Clinic and welcome to another episode of Sleep Talk. Okay, today we have a very special guest with us. He's none other than Dr. Lau Hung Tuan from My ENT Specialist. Hi Dr. Lau.
Hi Michelle, thank you for having me here today.
Thank you for accepting our invitation to come by. Okay, today we're going to take a look at snoring and we have a few questions to ask you. Okay, firstly, snoring is linked to obstructive sleep apnea. Is that correct?
Oh, that's right. Snoring is one of the symptoms that we look at when we are assessing a patient for obstructive sleep apnea, but it's only one of the symptoms. And, people do snore without obstructive sleep apnea. And I guess that's what we're going to try and find out today in this episode.
So, what is snoring and why do people snore?
So snoring is a vibratory sound that is created by your upper airway. Your upper airway consists of your nose, your throat, and the back of your tongue. When one snores, there is turbulence and resistance in the airway, so the airway is narrower. And because of that, certain tissues in your throat vibrate. Most commonly is your soft palate, which is the M that you see at the back of your mouth if you look into your own mouth. The second is also your tongue. The third are the side walls of your throat. And lastly, also, there's a cartilage at the bottom, at the back of your tongue called the epiglottis. So when you snore, these structures in your throat vibrate and it creates that rumbling sound that, we associate with snoring.
Ah, okay. So it's actually the vibration, is it, that actually causes the...
It is, yeah. So it's the vibration sound that we're hearing.
Right, okay. So very often, patients tell us, of course I snore, I'm a guy. What do you have to say about that?
Well, there's some truth in that. Snoring is never attractive. It's a social nuisance to some bed partners. We find that males do snore more than females. Not saying that females don't snore. If we look at studies that have assessed, how regularly one snores, and if we use regular snoring as more than 4 days within a week, then above 60 years old males, more than 60% of us do snore. For females, that number at the age of 60 and above is actually more than 50%. So it's fairly equal. But if we then go down to a younger age group, what you find is that about 30% of males regularly snore and about 10 to 15% of females snore. And that we're talking about, people aged between 20 to 40 years old.
Right. In that case, is snoring normal then? Or when is snoring considered abnormal?
So snoring belongs to a group of sleep-related breathing conditions, where on one hand you have a simple snorer, where you just snore occasionally, on and off. That is usually benign, meaning not harmful. Snoring can also be associated with other harmful conditions such as obstructive sleep apnea. In these sort of conditions, not only do you snore, you may have collapse of your airway that cause choking episodes at night. When these choking episodes happen, your oxygen levels in your blood drops, and then you don't get good quality sleep because it's disrupted. And instead of getting deep sleep, you get micro arousals or awakenings, and that can lead to a lot of stress on your body. So obstructive sleep apnea comes with snoring, but you can also get, people who only snore from time to time. Some people snore in certain positions. Some people snore because they're on alcohol or on medication. But if your snoring becomes more regular, so as what I said earlier, more than 4 days a week, or if it's very loud and it comes with other symptoms such as choking or tiredness, that's when I think, someone should get checked for their snoring.
Right. Okay, so what you're saying is if I'm snoring very often and if I'm snoring very loudly and if it's accompanied by choking, gasping, I should see a doctor.
Yes, that's exactly right. I think other than that, there are also other reasons that, someone may seek medical attention for snoring. And that could be that, someone's bed partner is just fed up that either they're having to sleep in separate rooms because of the snoring, or your wife or your spouse can't sleep very well. And sometimes the snoring can be so bad that even the person in the room beside can hear the snoring through the walls. So when we look at snoring, there's also a volume to it. So it's not just how often you snore, but how loud you snore. So generally, snoring occurs at a loudness of about 40 decibels and above. If it's mild, it's between 40 to 50. 50 to 60 is moderate. And, when it's above 60 decibels, that's really very loud, and we call that severe snoring.
Right. Okay, we sometimes hear kids snore. Is that considered abnormal or dangerous?
Well, I think in kids, snoring it's not natural. So, in a young person who presumably is not overweight, we don't expect young children to be snoring. I think that if the snoring becomes more regular, and if we notice that the child is having gasping episodes or a lot of mouth breathing as they are sleeping or in the daytime, I would get that checked. The reason I say that is that with kids, we don't often see that they are tired when they have sleep apnea, where they have these choking episodes at night. So they may not present with tiredness, but sometimes with a bit of inattention and actually hyperactivity in their daytime. We know that if someone is a mouth breather and are opening their mouth in the day or during sleep, that affects the way in which their facial skeleton grows. So from having a normal facial skeleton, if someone were to constantly breathe through their mouth, that may change the way that their face grows, and their face may then become longer as well as narrower and shorter. So we do want to try and prevent or at least reverse the effects, of mouth breathing and snoring in children.
Right. So, what if I choose not to bring my kid to get it checked or to seek treatment? What is the worst that may happen?
So in kids, because we have a developing facial skeleton, it allows, for changes to still occur. The worry that doctors have is that if someone was having sleep apnea, snoring and mouth breathing for a long time, the facial skeleton forms in the certain way that I mentioned earlier, where it's long and it's narrow and it's short if you look at it from the side. That may in the future predispose these children to having problems with sleep apnea when they're adults. Because once your facial skeleton has grown and has stopped growing, then the amount of space that you actually have in your airway is going to be fixed. As an adult, that facial skeleton is never going to grow any bigger. So we do have an opportunity when they are in their growing years to try and address these issues. And I think it's important that we're aware of that and try and nip it at the bud.
Right. If someone goes to you for snoring, right, with complaints of snoring, what are the possible treatments or the possible things you will get them to do?
So if someone were to see me for snoring, I think it's important to find out the details of the snoring, how regular and how bad is it affecting him, her, or their bed partner. We also want to know, is it causing them any other associated medical problems? And are there any red flag warning signs that they may have other symptoms of sleep apnea? It's important because we are naturally nose breathers also, for me to find out if these patients who see me for snoring are breathing well through their nose. Having asked the questions, we then will do an examination. So usually I will look at someone's facial skeleton, measure their weight and body mass index, and get them to fill up a tiredness questionnaire, and also then look at their airway. By looking at the airway, I look in the mouth, but I usually will pass a small nose scope through the nose to have a look at the airway from the nose all the way to the throat. By looking at all these assessments, I can then have a rough idea of what's happening in their airway that may predispose them to snoring. If there are concerns of obstructive sleep apnea, then I may order a sleep study. This can be done either in hospital or at home if you are the right kind of patient, to see if there's something more serious than just the snoring. You asked about treatment, so it really depends on what we find. If we're dealing with a simple snorer, it may be certain habits that they're doing that may predispose them to snoring. So things like excessive alcohol consumption, too much caffeine intake, or recent weight gain. These are risk factors that may affect someone's snoring. Treating the nose is something that we find is very effective in reducing snoring. There are also some devices that people use for snoring. So these may range from dental appliances that try to move your jaw forward or close your mouth so that your tongue doesn't get in the way so much and cause too much turbulence. And there can also be certain devices like a positive airway pressure machine. What this does is it blows up any obstruction in the airway, and by reducing the resistance and turbulence, it keeps the airway nice and open and there's no longer any vibration. Finally, there's also surgery. So surgery really depends on where I think the obstruction is and how much and how willing are we to take on some of the risks. So this may range from minimally invasive procedures to tighten the palate and reduce the vibrations, to more aggressive surgery to remove certain tissue, as well as to stitch the palate so that it's wider. And finally, there's also jaw surgery that we do to expand the whole jaw if someone's facial structure is just too narrow and short. So in summary, that's it. That's how we may assess someone for snoring and treat them.
All right. Oh, wow. Snoring can actually be a bigger problem than what most of us think, right? It's not just a sound.
Yes, so it can be a bigger problem. We know from some studies that chronic vibration of snoring can lead to some damaging effects to some of the nerve receptors and also the blood vessels within your throat. So it's something that, on one hand, snoring occasionally is not something which is very worrying, but we do want to be mindful that it can be something worse.
Okay. I bet a lot of people that are listening into this are a bit worried now after listening to you. Thank you, Dr. Lau, for answering all our questions. Okay, if we have more clarifications on the topic, we will be giving you a buzz and hopefully you can help us out. Okay, so once again, thank you so much, Dr. Lau.
Sure, it's my pleasure to be here today. I hope that what I shared was useful. Thank you very much.
Very useful, very useful. Thanks. Bye.
Bye.